Assalamu alaikum everyone. Hope you all are fine and learning from the Vital MEDICOS Hub virtual webinar series on power over diabetes. Today is our fifth session and the topic is complications of diabetes mellitus. So let's begin. Bismillahirrahmanirrahim. Diabetes mellitus patients often experience a lot of complications in long term because of persistent uncontrolled blood glucose levels. Diabetes and its long-term complication cost the National Health Service almost 10% of its total budget, which is a lot for the single chronic disease. Although all the long-term complications can occur in each type of diabetes mellitus, type 1 and type 2, but the spectrum of incidents would be different. Hyperglycemia and hypertension, increased blood glucose level and increased blood pressure are the two major modifiable risk factors which can be controlled that affect the further development of complications. Diabetic complications are divided into two types, macrovascular and microvascular complications. So let's look at both of these in detail. The complications of diabetes mellitus can be acute, short-term, and chronic, long-term. Acute conditions are DKA, diabetic ketoacidosis, hallmark of type 1 diabetes mellitus, a medical emergency condition and manageable by insulin and fluid therapy. Other conditions are hyperglycemia and hypoglycemia. We already discussed these conditions in our previous sessions of the series. Now we will focus on chronic ones, macrovascular, microvascular and neuropathic complications. This interesting figure depicts many points, such as diabetes mellitus is inherited disease, having risk factor of family history, and major complications of diabetes are related to increased risk of cardiovascular diseases, peripheral vascular and nerve damage, diabetic foot, kidney, eyes, teeth, gums diseases due to the decreased production of saliva, and during pregnancy complications, gestational diabetes. These complications occur because of persistent hyperglycemia or uncontrolled blood glucose levels. Macrovascular complications. What are these complications? These complications result from changes in the medium to large blood vessels. Blood vessels walls thicken and become occluded by plaque that adheres to the vessel walls and block the blood flow. The risk of macrovascular complication includes cardiovascular diseases such as coronary heart disease, myocardial infarction, heart attack, tissue death of the cardiac muscle due to ischemia or lack of myocardial oxygenation. And then hypertension is twice common in diabetic patients than the general population, affecting over 80% of the patients with type 2 diabetes mellitus. And lastly, the stroke. Another type of diseases is PVD, peripheral vascular disease. It includes atherosclerotic changes in the large blood vessels of the lower extremities, and these are responsible for the PVD, diminished peripheral pulses, gangrene, and leads to subsequent amputations, especially the lower extremities, legs. The risk of these macrovascular complications is 2 to 4 times higher for the people with diabetes mellitus. Let's look at the incidence of macrovascular complications in type 2 diabetes mellitus. The incidence rate of cerebrovascular diseases is only 1%, means the dysfunction of the blood vessels and the damaging of the blood vessels supplying to the brain. The incidence rate of abnormal ECG is 18% and hypertension is 35%, and then the 13% is the incidence rate for the absent full pulses, such as the absence of posterior tibial pulse, which is here, and the dorsalis pedis pulse, which is at the top of the foot. And lastly, intermittent claudication. It is the pain in the legs or arms caused by the too little blood flow to the muscles due to the narrowed arteries. When the patient is active or walking, the pain starts and it stops when patient rests. That is why mentioned as intermittent pain or claudication, mainly affecting the lower limb or feet. Cardiovascular diseases is the most common cause of death and having estimated 80% mortality rate in patients with type 2 diabetes mellitus. Myocardial infarction or heart attack is like common silent killer in diabetic patients. Multiple interventions required such as managing hyperlipidemia, hypertension with the help of dietary modifications and medications to prevent the risk of cardiovascular diseases. Treatment of hyperlipidemia with the help of anti-hyperlipidemic drugs such as statins, atorvastatin, rosuvastatin at night, smoking cessation, weight reduction, antiplatelet medications such as aspirin, clopidogrel once daily to avoid the blood clotting risk of myocardial infarction and stroke. Peripheral vascular disease affects the blood vessels outside the heart. If the PVD is present, the risk of cardiovascular disease increases, and about 20% of people with PVD die from myocardial infarction within 2 years of appearing the symptoms. In diabetes mellitus, it often affects the arteries of legs and may appear as intermittent claudication, means cramping pain experienced on walking due to muscle ischemia secondary to atherosclerosis. That is why PVD is responsible for the morbidity rate associated with diabetic foot problems. For the treatment of PVD, smoking cessation, correction of hyperlipidemia, and antiplatelet therapy is necessary. Cilostazol, a drug used for the management of PVD in the dosage 50 to 100 mg BD. This drug is a vasodilator and inhibitor of platelet aggregation. Is given in only selected patients. Local debridement means the removing the dead tissues and cleaning the area of infection, and appropriate foot care is necessary to avoid the DFIs, diabetic foot infections. Topical treatments. Topical creams are necessary and required according to the type of diabetic foot infection. Microvascular complications. What are these diabetic complications? These are characterized by capillary basement membrane thickening or narrowing of small blood vessels. Two most common conditions of these microvascular complications are diabetic retinopathy and diabetic nephropathy. Diabetic retinopathy affecting the eyes and is caused by the changes in the small blood vessels in the retina, leading to blurred vision and blindness. That is why it's very important to maintain the blood glucose level to avoid the retinopathy and nephropathy, because the care of eye and kidney is important. Diabetic nephropathy, secondary to diabetic microvascular changes in the renal, affects GFR and causes albuminuria, albumin protein in urine, oliguria, low urine output, pitting edema, and leading to end-stage renal disease, ESRD. And the third complication is neuropathy. Refers to a group of disease that affects all type of nerves, mostly peripheral nerves and then the autonomic and spinal nerves. The incidence of microvascular complication in type 2 diabetes mellitus are retinopathy affecting the 21% of the patients, and nephropathy chances of incidence are 18%. Erectile dysfunctions incidence rate is 20%. Ischemic skin changes associated with the foot is 6%, and abnormal vibration threshold also associated with the foot is 3%. As we can see, the diabetic foot conditions are common in both macro and microvascular complications. Diabetic retinopathy. 20 years from the onset of diabetes mellitus, over 90% of the patient with type 1 and over 60% of the patient with type 2 will experience diabetic retinopathy. For the treatment of retinopathy, glycemic control and blood pressure control are crucial to reduce the incidence of developing diabetic retinopathy. Early detection will lead to a procedure, laser photocoagulation, use of laser to treat retinal condition, and then in advanced cases, surgery is required. So, to prevent the surgery, blurred vision, and blindness, one should control the hyperglycemia and hypertension. Third condition in microvascular complications is diabetic neuropathy. Diabetic neuropathy can be due to a variety of nerve damage, sensory, motor, and autonomic group of diseases that affects all type of nerves. It's more prevalent in elderly patients with type 2 diabetes mellitus. Painful diabetic neuropathy. It's another manifestation of sensory neuropathy, loss of sensation in the body, and it could be extremely disabling condition and may cause morbidity. Peripheral neuropathy. It occurs in 25% of diabetic patients and is characterized by paresthesia, means the feeling of pain, tingling, numbness, or pins and needles in hands and lower extremities. Autonomic neuropathy. Gastroparesis. Gastroparesis is the condition which leads to feeling of fullness and nausea, urinary retention, rarely postural or orthostatic hypotension, and very uncommon condition is diarrhea. So the most common neuropathy in diabetes is peripheral neuropathy. Other two conditions are rare. For the treatment of diabetic neuropathies, the first approach is to control glycemic level, and the pharmacological therapy is symptomatic, means alleviating the symptoms, and the empiric therapy such as low dose TCAs, tricyclic antidepressants such as amitriptyline, imipramine, and anticonvulsants are given most commonly gabapentin and pregabalin in the practice, rarely carbamazepine, and duloxetine and venlafaxine from the class of serotonin selective serotonin and norepinephrine reuptake inhibitors. And then the topical preparations are capsaicin, means the capsidol lotions or creams, and the various analgesics such as the opioid analgesic tramadol and NSAIDs drugs are given for the relief of pain in these neuropathies conditions. Here are the short assignments. What are the long-term complications of diabetes mellitus? Please specify shortly. What is PVD? Explain with examples. What is the most common condition of diabetic neuropathy? So we are ending today's session. Hope you all learned about complications of diabetes mellitus. Please don't forget to share, subscribe and like. Thank you.